Good morning, everyone, or evening, depending on when you're watching this. I'm going to be talking about death and dying. This is something that most people don't want to talk about. It's not something that we're excited to get into, but this is important, and it's going to be a huge part of what you do, no matter what area of nursing you decide to go into. You know, sometimes we think, well, I want to work with kids. I don't want to think about death and dying, but certainly in that area we will deal with this as well. So you need to be prepared for it. So we're hopefully going to get you a little bit ready today. So first of all, you need to figure out how you feel about death. Like I said, a lot of people don't want to think about this, but take some time to explore what you believe in life after death. Think about your culture, you know, how do you express grief? What does it look like? Are you afraid of death? They've done a lot of studies on caregivers surrounding death and found that people who are dying get less attention than anyone else. And that's because of our fear, our own personal fears of being around people who are dying. That's not fair to the person who is dying. It's not fair to the family that's with that person that is dying. So you need to start exploring your own feelings about death. You know, they've done other studies too that show that new nurses within the first 3 months of working usually deal with something like this. It's very difficult for them. So you need to prepare yourself. The person that is dying should get just as much attention as every other person that you're taking care of, if not more. So remember that we are holistic, right? We take care of the whole person. So we take care of the person who is dying physically, certainly emotionally, and we take care of the family. Sometimes it seems like the family is really your patient. You know, the person that's dying, they may be unconscious. They might not be aware of what's going on, as far as you know, but the family is so emotionally drained that you have to really be a source of strength for them. Something that I can promise you is that the family will always remember the care that they received when their loved one died. They will never forget you. So you really have an opportunity to make a big impact here. Some of you might experience this in clinical. You know, that certainly happened where we become attached to our residents in clinical and they end up dying while we're there. And that can be hard on you. It's hard for the family. It's hard for the rest of the staff who's taking care of that person for years. So you need to take care of yourself. One of the things we talk about in this class is the way we cope with stress. So you need to identify your own coping mechanisms, you know, make sure that they're good coping mechanisms. You can't go home and drink it away, right? We already know that that's not an effective coping mechanism. So start working on ways that you can deal with stress now. Otherwise, this will consume you. You need to find somebody to talk to. You know, this is easy to say, but truly in healthcare, we're not allowed to talk about the things that happen when we're at work. So we tend to hold it in. But if you hold it in, it's going to consume you from the inside out. So find someone that you can talk to, you know, whether it's your coworkers or clergy, somebody at work. The nice thing about being in school is that you can talk about these things in post-conference, at clinical. You know, this was really hard for me to deal with, but you need to get it out. Just get it all out so that it's not stuck inside of you. You also need to be respectful of other people and the way that they handle grief. You know, so this can be different for every person. Some people are very stoic in the way that they handle grief, meaning they don't show those emotions. And some people are very vocal and loud about it. That doesn't mean that one person's experiencing more or less grief than the other. Just like when we talked about pain, you know, one person can express pain a lot differently than another person. But that doesn't mean that that person's having more or less pain. A lot of that has to do with the way you were brought up, the way you were taught to express yourself. So be respectful. The way that we express grief, you know, whether it be us personally or whether it be the family that we're taking care of or the patient or the resident that we're taking care of has to do a lot with your life experiences. If you've had a lot of death in your past, or especially a recent death, that's really going to influence the way that you are around that person who is dying. It can be very difficult sometimes. I know when I was a new nurse, I really hadn't ever experienced much death. I mean, my grandmother died, but I was a kid when it happened, so it didn't really affect me much. So the first time I lost a patient, it was kind of shocking to me. So your experience really shapes the way that you treat others when you're taking care of them. Think about your culture. You know, there's some cultures, like I said, very vocal. For example, you know, we had a young lady one time who drowned, young lady, and she was from India and her family was there, and they were very vocal about their grief. But I've had some other cultures, like a lot of white cultures in America, don't express much grief. So when you tell them their loved one has died, they'll just be, okay, what do I need to do now? What's the next step? So some cultures, you know, they believe in wailing. So they might scream, they might cry loudly, throw themselves on the floor. You have to be respectful and be ready for whatever that person does. Religious beliefs too, those are important. You know, some beliefs, they don't want to leave the person who has died until they've been picked up from the funeral home. Others, they'll just visit for a little while and then they're ready to go. Some people don't even want to see that dead body at all. And age is going to play a major factor. If you have a young person who's died, that makes a big difference than someone who's 99 and lived their life. So again, think about how that affects the loved ones, family. Think about how that affects you. So we talked a little bit about terminal illnesses. A terminal illness is something that someone is not expected to recover from. So some examples of that, you know, probably the first thing that popped in your mind was cancer. You know, that's not the only terminal illness. You think about, we've talked about ALS in this class. We've talked about, you know, COPD, that could be terminal. If it's severe enough, that person's not going to recover from it. It's going to progress. Dementia, you know, that's expected to progress, and people aren't expected to recover from that. So there are a lot of different terminal illnesses. Usually when somebody goes into hospice care, it means that we expect them to live less than 6 months. Of course, that's impossible to say exactly how long somebody's going to live. Sometimes people surprise us and they live for years when we thought they would live just a couple of months. Or sometimes we think this person has a long time and then suddenly they decline really rapidly. Palliative care focuses on symptom relief. Okay, so somebody who's on palliative care, they might still be on their blood pressure medicine, their insulin, because we want this person to be comfortable, but we might not be really aggressive with healing them. Okay, so if they have cancer, they might not be getting chemo and radiation, for example, to heal the cancer. They might be getting chemo and radiation just for symptom relief, you know, to shrink that tumor or to increase their life expectancy, but they're not going to get well, if that makes sense. These are the stages of death and dying. They're also called the stages of grief. So you're going to see this over and over again throughout your nursing school career. You need to know that every person's different. Every person experiences grief differently. These are the expected stages that you might see, but somebody, you know, they could start out with depression, or they could start out bargaining, and they might skip back and forth between stages. You know, they might reach that last stage of acceptance and then skip back to denial. So, and the amount of time in each stage is definitely going to be different for each person. You know, some people, they might remain in depression for a very long period of time. Here they are again. So that first stage, denial, that's just, a defense mechanism. That's natural, it's normal, it's expected. That when you get bad news, you can't believe it. So for example, part of my job at the hospital is to deal with every death that comes in. So sometimes I have to go be the one to break the news to that family that their loved one has died, and this is probably the most common reaction that I get. No, that's impossible. I just talked to them. I can't believe it. That's a normal reaction. It's your body can't handle, your brain can't handle that information, so it just denies it. There's really no point in arguing with somebody who's in denial, because that is a defense mechanism, and they're probably going to come out of it eventually. Anger. That's also a pretty common reaction. And since that person doesn't want to take their anger out on the people that they love, it's easy for you to be a target for that anger. So do not be surprised if that person comes at you very angry. Or they might be mad at God, they might be mad, at everyone around them. It's not fair. So these stages of grief don't have to just do with dying. It might be, after you get a terminal diagnosis of cancer, that person's going to go through these stages of grief as well. Bargaining is also very, very common. God, if you just let me live long enough to see my daughter graduate from high school, I will give all my money to the church. And there's an example, or if you just give me a healing, then I will never smoke again. So people like to make deals, and the person that they usually make deals with is God. Then we have stage 4, depression, where the person, has accepted the news, but they're not happy about it. And so you might see crying, may become withdrawn, not wanting to talk about it, don't want to be around people. Sometimes we can give medication for this stage, and that could be helpful, especially if it lasts for a long period of time. Hopefully this person will get to the 5th stage of acceptance, where they're calm and at peace with what has happened. But as I said, some people might hit that acceptance stage, and then they might revert back to other stages. So it's going to be different for everyone. So be prepared for any of those stages when you're talking to somebody who's dealing with grief. If you've never seen someone die, there are some things that we expect to see as each body system begins to shut down. So if you think about your cardiovascular system is shutting down, so your blood pressure is going to drop. There's going to be less circulation. You're going to start seeing that in the peripheral body first, so feet and then hands, they're going to start becoming blue, cyanotic. You're going to see mottling. I have a picture there if you've never seen that before. You sometimes see this in very pale people when they're cold. Almost looks like patchwork on the skin. And that will start in the extremities and move its way up. People become very cool and clammy to touch. As your respiratory system shuts down, you might start hearing real noisy breathing. People don't have the strength to clear their airways anymore. They can't clear their throat, so you're going to start hearing some of that mucus build up in there. Can't swallow their spit, so they start drowning in it. So they sound wet. If they're getting palliative care or hospice care, there's medications that we can give people to dry them up so they don't feel like they're drowning in their own secretions. Cheyne-Stokes breathing is something you would hopefully only see in somebody that's expected to die. And that is when people have very rapid breathing, in and out, and then they have a period of apnea. And remember, A means without, apnea, breath. So they have a period of no breathing. So rapid breathing and then no breathing. And that could last up to a minute. And then another period of rapid breathing. And that's just the body shutting down and then trying to kick itself back in, but then shutting down. Death is very uncomfortable for the person that's going through it. So, we give medications as nurses to help ease that process, morphine, for example,